God, me and technology. This is the third time that I've recorded this message. I'm 7 months post-surgery and I forgot I'd left my Bluetooth headphones switched on. So my voice wasn't being recorded. So the previous message just went up blank, which is a bit shit, but never mind. So yeah, 7 months post-surgery. As I said in my last vid, that I've been taking the curcumin supplements for about, I think it's about a month, something like that. So I've been taking them a couple of months now, and really been on the PEA stuff that the pain specialist suggested that I try. And I showed you those in the last vid as well, so if you need those. So things continuing to go really well. So I'm kind of doing hydro 3 times a week. Maybe I'll slip in the odd fourth one, but the fourth one's more of a kind of sit in the sauna and just chill out and just relax as much as I can. Just kind of stretch out. Still not doing too much, still just doing as much as I feel is right. Got the treadmill outside and the exercise bike, and haven't touched them, to be honest. I'm going to wait a little bit longer. Probably okay to go on them, but I just don't want to. I'm going in the right direction now, and I just don't want to mess it up, you know what I mean? So I've kind of got into a routine, finding what's working, feeling better and stronger each week. Still feel something in my hip, like this sticky out thing, which is dead weird because they never went anywhere near that, but I think that's just still some inflammation around that area where I can feel it. So hopefully that'll subside as well. So yeah, it's just a bit of an update. I've got a mate of mine that he's going through a similar sort of thing. He had not a fusion, but he had something similar, which I think, if I remember right, is like 6 months, something like that, post-surgery, and he's really struggling. So I suggested he watch my videos. So yeah, I hope they help him, mate, and I hope you feel some sort of relief soon. But I'll keep in touch with you, and we'll keep in communication, and just I'm there if if you need to pick up a phone. I know I'm in WA, and the hydro thing is kind of okay for me. I know it must be really tough for you guys that are in lockdowns and stuff around Australia and stuff like that, having a lot of these facilities closed and stuff. So I know I'm lucky in that respect, but if you can, and these places reopen, then I certainly think about the hydro, because the warm water and the kind of the low impact kind of exercise has been great. It's been really useful. So I'd recommend trying that if you can. So anyway, it was just a bit of an update, just to say I'm still here, still progressing well. I think it's down to the anti-inflammatory supplements and a bit of time, I think, and just, again, what I've always said is just listen to your body, not really what other people are telling you to do, targets and sort of like what you should be doing and what you should be achieving, and just listen to yourself. Take it easy some days. Normally after a hydro session, I'm kind of still a tiny bit achy after doing those exercises, but I've just got to accept that I haven't been doing those exercises for probably a year, because I wasn't doing them when I had really bad back pain, prior to having the surgery, and certainly haven't been doing them post-surgery. So all these muscles and stuff, they've not been used for ages, so it's not surprising that they're going to be tight and give me a little bit of jip after I've had a bit of you know, a steady session. You know, I'm not pushing things hard, not, but you know, if you do get the ache the following day, uh, that's kind of, yeah, that's all right as long as it's not pain. And then the following day it's kind of all right again. So if your aches are kind of hanging around for more than a day or two, then probably just rest up a little bit more, just take it steady, and then when things have calmed down a bit, then just go back to doing them, but maybe just not as hard. Just try and time stuff what you're doing, or count stuff, and then you know how much to back off by. Yeah, keeping a diary is a good one. I've always kept a diary of how my head's been, how my body's been, and kind of the stuff I've done. Just because, like, I've got a memory like an absolute sieve, so you know, I can't remember kind of what I did the previous day really, and it's good to be able to look through that diary and say, oh yeah, I did that. Yeah, that explains why I'm feeling the way I am today, or you know, just you know, get your head in the right space, just trying to explain stuff that's happening. Because depression is, you know, I've got tablets for depression. Never suffered with depression my entire life until I had this surgery, and it's really common. Anybody who's in long-term pain, it's normal. You know, it's not just a physical thing you've got to try and recover from. It's like the mental impact that pain's had on you for so long, and it, you know, it's you know, it's nothing to be ashamed of. It's a chemical imbalance in your brain. That's what depression fundamentally is. That's my understanding anyway. So sometimes you just need some medication to get that balance back in order, and it may take a couple of different types of drug to get you on the right way, because you know, obviously the body's a very complex thing. So once you get that in order, then you know, keeping your head in a good space is going to help your physical recovery. That's my understanding anyway. So you know, don't disregard going to the doctor and discussing depression or mental health, because it's an important part that you've just got to deal with and address. If you know, if you think you're being kind of impacted by that, and yeah, just you know, give yourself a trial version to Calm app. There's a great series on there about how to handle pain. Can't remember exactly what it's called, but if you stick in search pain, and it's really good. It's a 7-day kind of course, if you like, that you're meant to do every day, and it only takes like 15-20 minutes, and it gives you some real good techniques to try and use to kind of get your head in a better space and deal with the pain. I found it really hard to get into that mindset, really hard, and it took me a few goes, but you know, nothing else to do, so why not give it a crack? Like I've said a few times to other people, I've literally got nothing to lose. You know, I've got I don't mind trying new things, you know, or different things, different therapies, because what's the worst that can happen? That don't work. But anyway, I'll give you another update. Yeah, probably 8 months. So yeah, I'll speak to you then, and yeah, hope. Okay, man, you're all right, and I'll keep in touch. Take care, fella. Bye, and take care of the rest of you lot as well. Cheers now. Bye.